The brain is the most complex organ in the human body, and perhaps the most remarkable. But 1 in 5 Americans will suffer at least one form of mental illness in his or her lifetime. Treating mental disorders can be complex and are considerably different than treating physical ailments. The overprescribing of psychotropic drugs as a first-line treatment by primary care physicians who may be unqualified to treat mental disorders has been a concern of many mental health professionals.
Mental health is caused by conditions in one's lifestyle, various brain injuries and that sort of thing that are reflected in symptoms, and psychotropics currently are treating nothing but symptoms like depression and anxiety, where these are symptoms like a headache. They can be anything. A headache can be anything from a stroke to a mere eye strain. If you merely give aspirin for the headache and the person has had a stroke, the person may get temporary relief from pain, but then may also die.
The side effects of these psychotropic drugs, such as antidepressants for instance, has been well documented.
Insomnia, weight gain, sexual dysfunction, loss of interest in sex would be primary side effects. There are more serious side effects such as seizures, a drop in blood pressure causing dizziness, fainting, falling, which would result in broken bones, especially in the elderly. And suicide attempts and suicide thoughts and suicide completion with children, adolescents, and young adults.
Mental health professionals have the training, the qualifications, and the experience to fully understand, diagnose, and treat mental illness. Yet in many cases, family doctors and general practitioners are prescribing powerful psychotropic drugs as a first-line treatment.
There are many reasons why psychotropic drugs are being prescribed as first-line treatments as opposed to psychotherapy. Primarily, it's a result of the direct advertising by pharmaceutical corporations to consumers. Consumers then go to their primary care physician as a result of the advertisements and then ask for a particular drug. Physicians who really have very little time to deal with these patients and their problems prescribe the drugs and send them on their way. Lastly, it's a problem of the Food and Drug Administration's lax and ineffective regulation for so many of these drugs.
This medication-only approach is having serious impacts on the patient population.
The primary impact is that the underlying causes of the behavioral, mental, or emotional disorder doesn't get addressed. Medications target symptoms, and as long as you're looking to control symptoms, which the medications do most of the time, you're not really addressing the underlying mental, emotional, or behavioral disorder.
Behavioral health interventions like psychotherapy, lifestyle changes, and so forth have been treating mental conditions for many, many years successfully. They address the underlying problems that are causing the symptoms rather than just address symptoms. The psychotherapy is successful without all of the many, many side effects that psychotropic drugs have, and so consequently they are in most cases preferable as a first-line intervention in mental conditions.
The prescribing of psychotropic medications to adolescents and children who present with behavioral and emotional problems has reached critical proportions.
There simply is no scientific basis for diagnosing and medicating many of these normal childhood responses, even when we see some behaviors as abnormal and unwanted. Although the responses to psychotropic medications sometimes are desirable, these medications always cause a host of neurological and biological complications, some which may not be seen for years. For physicians to believe that they are safe for children is completely unjustified by what we know from the research and by simple experience.
While the medications may get the desired result in controlling symptoms, many mental health professionals feel those children are not being adequately treated.
Adults, parents, and school, and the doctors are supposed to be there to serve the child. And unless we stop the massive medicating of children with behavioral issues as a first line of defense, we will see our children continue to suffer and will continue to see children who first present with mild inattention and other behavioral issues escalate to more severe disorders and behaviors from both the medication side effects, but also from missing the opportunity to do real treatment with a doctoral level psychologist.
NAPPP, the National Alliance of Professional Psychology Providers, is an association of professional psychologists dedicated to promoting quality psychological practice with an effective and caring mental health system.
The mission of the National Alliance for Professional Psychology Providers is to educate the public to ensure that they are receiving quality medical care and psychological care and a quality standard of care, which we believe is not present at this time due to the medicalization of mental, emotional, and behavioral health.
The group intends to accomplish its mission by promoting public awareness of the mental, emotional, and behavioral healthcare system that's presently being practiced.
We intend to advocate, and we are advocating, for standards for prescribing these medications. We're not against medications, but what we are against is the inefficient and ineffective use of these medications for patients who are being treated in a medical venue when they should be treated by doctoral level specialists in mental and behavioral health.
To learn more about the National Alliance of Professional Psychology Providers and its mission, visit nappp.org. To learn more about the Truth in Drugs campaign, visit truthandrugs.com.